I started actually at 7 years old, wanting to be a doctor, and decided early. Wanted to help people, do things to make an impact on society. My practice focuses on wellness and prevention, but also diagnostic and therapy of heart disease. Women are always concerned about breast cancer, and unfortunately 1 in 10 women die of breast cancer in their lifetime. But heart disease is much more prevalent. 1 in 4 women will die of heart disease in their lifetime, so it's a much bigger problem than the breast cancer. Women's symptoms of a heart attack or a warning are much different than a man's. In fact, 2/3 of women have no warning symptoms at all before their heart attack. When they do have symptoms, they're unusual compared to a man's. They're not the heavy pressure that we see on TV, the dramatic event. It's more subtle. It may just be fatigue. It may be a sharp pain. And it may not be in the chest. It may be a burning. Maybe more in the stomach or the neck or the shoulders or in the back. It tends to be less often in the chest like a man's would be. When unusual symptoms develop or are concerned that something may be wrong, first thing to do is an aspirin. Helps to thin the blood, keep the arteries open until we get to the hospital. Then call 911 and try and relax the patient in the meantime. It's a very nervous situation, and that's to be understood. But reassure them they'll be getting help. People should be checked early on because even in their 20s, 1 in 11 20-year-olds has a blockage that could be stented. And so starting early is never too soon. I've had a gentleman, he used to be a principal of an elementary school. At 35 years old, this man who had jogged every day since college, was slender like me, never smoked, had a heart attack, almost died, probably my worst case ever. And he had high cholesterol unknown to him. No family history, but if he would have gone and been checked for simple screening for blood pressure, diabetes, cholesterol, they could have found this and we could have intervened on it early. On the wellness side of heart disease, that's very important. Watching our blood pressure and controlling that, taking a low-fat diet with low animal fats, high vegetables, fiber, and low carbs. Exercise daily, about 30 minutes of exercise a day, 5 days a week. And you go, oh my God, I can't take the time to do that. That's too much. Well, just something as simple as walking. You don't have to go and be straining, lifting weights, and doing a vigorous work. Just some activity to get the blood circulating is good enough.